we do have to prepare for potential for another wave. And I mean, we always should prepare for the fact that the second wave could even be worse than the first wave. So that's a very important question. So we know that with the collective efforts, we did not exceed the health system capacity to cope with this initial wave, this first wave. So that's obviously been a tremendous amount of work to do that. But we got to keep going to increase capacity. I know that we haven't exceeded our ICU capacity, but I think provinces are continuing to ramp up, including ventilators and other supplies. But also, of course, as everybody knows, keep going on the ramping up of personal protective equipment. That's very important, should we get more patients as well. And also, generally, I would say, having learned perhaps how people have capitalized on virtual care, etc., keep going at some of those efforts that have worked, because some of those similar approaches should be continued so that you leave enough health system capacity. Of course, one of the key features of the current pandemic is the long-term care homes and seniors. So I do think that there's more work to be done in that area. Some of the long-term care homes or senior living areas haven't as yet completely extinguished their outbreaks. So that also tells us that we have to just keep going with those capacities, as well as the capacities for infection prevention and control in some of these higher risk settings, including shelters and in correctional facilities. But I think you can never be overly prepared, and that we need to just keep going with some of these capacity developments. And that goes along with lab testing as well. We're continuing to procure and including ramping up domestic capacity for some of our laboratory requirements.